What to expect when seeing a psychologist for the first time. Now, as you all know, I've been a psychologist now for over 10 years, so I've run a lot of first sessions with a lot of different people. And while sessions do change from person to person, the first session usually follows a variety of different guidelines so that I can gather the information that I need to best help you. So even if you're seeing a psychologist that's not me, chances are you may encounter a few of these things. Firstly, you may have to wait in the waiting room for your first appointment longer than you thought you would. This could be because the psychologist is running overtime in their previous session. What I've noticed is sometimes clients will bring up something really important right near the end of their visit, and I need to support them and I need to help them through that moment. And I'm going to take the time that is needed to work through that together. Rest assured, your psychologist will finish up their session and they will come out and they will get you. Often, if a psychologist has gone overtime with the patient before you, you will feel unrushed in the session that you have with them because they are prepared to take the time to listen to you and they're not clock watching the whole time, which no one wants that. So sit tight, read a magazine, and know that they'll come out and see you as soon as they possibly can. Once you sit down in the psychologist's office, they're usually going to get straight to the point and ask you how they can help or why you're there today. Now, I know this can put you on the spot and you can think, oh my goodness, I'm here for a variety of different reasons. So I encourage you to say in the simplest way possible what you need help with or why you've come to visit them. Things that are helpful for me to hear sometimes is, I'm here because I need some help with my anxiety. Or I'm here because my relationship with my boyfriend, girlfriend, husband, wife isn't going the way that I want to anymore and I'm feeling really unhappy. This little statement helps the psychologist ask the questions that they need to ask to get the information that they need to help you the best. They might ask you to talk about the past. Now, the reason that psychs often ask you to talk about your childhood or how you grew up or your mum and dad is because they're trying to get an understanding of how your issue has developed over time. If, for example, you have anxiety, what they're trying to figure out is, have you had anxiety your whole life, or is it something that's just popped up in the last few weeks? If you're experiencing problems with your husband, wife, there's relationship issues, what they might be trying to figure out is, have you felt like this before in other relationships? Talking about the past is a really important part of the psychologist getting the information that they need to help you in the current situation and moving forward in the future. They might ask you questions that you feel are totally irrelevant to why you've gone there in the first place. They might ask you about your hobbies. They might ask you about the things that you enjoy doing. They might ask you about the TV shows that you watch or the music that you listen to. And that can feel like it's completely off track, or it can feel like a waste of time. Rest assured they are asking for a reason. They realise that you are a unique person. Yes, you might have anxiety like some of their other patients or clients, but you are unique in yourself. And the way that you experience anxiety might be very different from someone else who experiences anxiety. Or some of the things that you enjoy doing with your spare time might actually help you with the problem that you've gone to see them for. So bear with them, answer the questions. The more they know you, the better shape they're in to help you. They might interrupt you or redirect you. Now, I know that you've gone there and you have a lot to say and you want to give them the most accurate picture of what's going on for you and how you feel about it, and you just want to get it all off your chest at the one time. But the first session is often an information gathering session. So your psychologist might be asking you about so many different things and trying to construct a timeline in their own brain. If they're interrupting you, please be assured that often in the second session, the third session, and many sessions beyond then, they will have the time to listen to how this is affecting you. And you'll have the space to release the emotions and feel like they understand. But in the first session, they may need to push you along a little bit just so that they can get an idea of the whole picture. And then they'll come back to the little parts. Be prepared to be asked about your risk. Most of the time, a psychologist will ask whether you're feeling suicidal or like harming yourself in a first visit. This is part of their job. A psychologist has signed an oath to keep their clients safe, And if they don't know if their clients are at risk or not, they can't do their job properly. So they will ask some really hard and uncomfortable questions sometimes, and I really encourage you to be honest. They are not going to be shocked and surprised if you tell them that you have had some thoughts or you have done something to yourself in the past. They will often take that information in and, in the scheme of the session that you've had, make a plan to keep you safe and to work with you to get better rather than stay stuck where you are. Now, please be assured that psychologists cannot lock people up in a psych ward. I know a lot of people don't tell psychologists they're feeling at risk because they're worried about the old straitjacket. Please know that we can't do that. In Australia, we simply do not have the power to lock people up. But if we do think that you're at immediate risk of harming yourself, we might call others in for help, but we'll always let you know before that happens. Finally, you might walk away from your first session feeling a bit worse, not a bit better. Now, this is because usually we've stirred up a lot of emotions. We've talked about things that you've avoided, or we've talked about things that have been bothering you for quite some time. So it's just brought it all to the surface, leaving you feeling emotional, exhausted, over it. Please know that in most cases, you will feel better the longer that you're attending sessions, and you'll notice that your symptoms will reduce. But the first session can really stir some things up. And if they are painful emotions and you are worried about how you might cope after your first session, bring it up with the psychologist. Say, hey, I don't think I'm going to cope really well when I get home today. Can we talk about a couple of strategies of things that I can do when I get there? More often than not, your psychologist will be more than happy to oblige and give you some handy tips to tide you over to the next visit. So there are a few ideas about what to expect from seeing a psychologist for the first time. Now, please remember that psychologists are people too, and they are all different. So some of the things that I've talked about today, you might not encounter in your first session. It just is that people have different styles, but I hope that some of the things that I've prepared you for are things that you will expect when you see them. Good luck for your first session, and if there's anything more that I can do to help, please leave a comment or send me a message.